Hello everybody. Actually, let me get my AirPods in. I think I am connected. Hopefully you can hear me all. Anyway, hi, this is Dr. A with Q&A with Dr. A. Sorry about last week. We had a little bit of technical difficulty with getting the Facebook Live to load. I'm not the most computer savvy when it comes to Facebook or some of the social media stuff, so I'm getting better at it. But anyway, I just wanted to thank you guys for tuning in again and just getting this all set up. But our topic last week was going to be heart health, and so that's what we're going to talk about again today, because there's obviously a lot of important information we can talk about the heart, and then how some of the therapies that we have in our program, and some of the things that you guys can do to reduce risks and make sure your heart is healthy, so you guys can stay well and happy. But just let's get into a few things about the heart, and then we'll talk a little bit about the importance of how the heart works and things that we can do to prevent heart disease. And I usually say that the gastrointestinal system is the heart of the body, just because it's just so important. When we talk about micronutrients, absorption, the microbiome, how it affects our neurotransmitters and our hormones. But truthfully, the heart, obviously, if we do not have a heart, we're not going to be able to rely on our microbiome at all. And so just talking about the heart itself, I mean, it's obviously one of the main risks or main concerns for people as they age. Once we hit that 50 years old, people start to really think a lot about their heart, the health of their heart, and it starts to become almost you can't get it off your mind, just because at that point is when one philosopher said it really well, is that we really have two lives. The first life ends when you realize the second life starts when you realize the first life has a finish. And that's kind of the way I think what happens in midlife crisis. And that's, if you think about that, that makes a lot of sense. We go through our early years almost feeling like we're immortal. And then all of a sudden they say you hit a midlife crisis where you start doing funny things. But it's not that you do funny things. I think that is exactly the way you look at it, is that, your first life, you realize, has a finish line. And so that's when your second life starts, is when you realize that. And that's what makes people start looking at the value of time and understanding, what am I going to do with that time? Because guess what? Something bad can happen, and they start really trying to figure out ways that they can reduce risks. And so that brings us into the heart. So, the heart is a muscle. So if you think about it that way, if you've done any sort of exercise, and your goals of exercise is obviously to improve your muscle mass and make sure that the muscles are functioning well, so it supports your frame and reduces risks of musculoskeletal injuries. So if you look at your heart, it's kind of the same thing, but the heart obviously is a necessity, because that is exactly what pumps the oxygen to our tissues to keep us living, also sends all the nutrients throughout our body. Our heart averages about 100,000 beats a minute, pumps about 2,000 gallons of blood through our body every day. And so when you kind of look at, when you really think about how our body functions, it's kind of freaky to think about just what it does on a day-to-day basis. And especially when we look at some of our lifestyles and realize just how hard we can abuse our body, but yet that heart just keeps cranking and cranking and cranking. And so when you think about the importance of the heart and how much work it does, like an engine, just like a car, when you have a brand new car and you decide to buy a car with a some sort of a turbo, or 8-cylinder or 12-cylinder engine, that car is going to be something that you really pay attention to, that engine, because that's what you paid for. And so, and I always say that your body is your biggest asset, so you should invest in it. So your heart should be one of the most important things that you pay attention to. So you can see how hard it works every day. So then you start to wonder, okay, well, how can I reduce the risk of having a heart that does not function the way I need it to? Like I said, because eventually your risk for heart disease is going to start playing in your mind. And you don't want to start working on your heart health after it's too late. So, let's talk a little bit about some of the variables or exposures or lifestyle choices that can cause heart damage or increase your risk of having heart disease. And I'm sure people can list as many many of the ones I'm going to talk about. But these are very important because these are just, a lot of them are just lifestyle choices that you can really reduce your chances of having a catastrophic event, especially related to the heart. But you can think high blood pressure, high cholesterol, smoking, obesity, diabetes. You can even get into some of the sleeping disorders, especially like sleep apnea. Just even having poor sleep habits has effects on the heart. But so you can kind of think of the top ones. The two most preventable risks in health is obesity and smoking. And what that means is preventable, meanings if you can prevent those are things that you can prevent. You can't prevent genetics completely. There's certain things that that you can't completely prevent, but almost always there's ways that you can improve or reduce the risks of certain risk factors. But smoking and obesity are the easy ones. So if you're smoking, you need to stop smoking, and I know that that's a big challenge, but that is it actually took over, obesity actually took over smoking as the number one most important preventable health risk. And so that we kind of are in an obesity epidemic. So, obviously challenging yourself to change your diet, and we'll talk a little bit more about that. And then obviously changing the smoking. And if you're thinking about quitting smoking, just make sure you don't feel that vapes and nicotine is a good option, because what's happening right now is that people are trying to quit tobacco and they're switching over to vapes or nicotine pouches. And what's happening is that they're getting a considerable amount more nicotine with those choices than they were in the cigarettes. So you're basically changing one problem and adding another problem. And they're just different. You're not going to have the carcinogens and the plaquing that's going to affect your lungs and your oxygenation and your heart with the tobacco. But then you're taking the nicotine and taking the amount of nicotine in a cigarette and multiplying it by sometimes 20 to 30 to 40 and doing it all day long. And that nicotine is starting to cause severe addiction to a lot of people. And you don't realize how bad you're addicted to nicotine until you try stopping the vapes or the nicotine pouches. So just be very careful. So as you kind of realize the reasons that can increase your chances of heart disease, you have to start thinking about ways that you can reduce those risks. Because when you look at the structure of the heart, and you kind of, the basic physiology of the heart is that the right side of the heart pumps blood to the lungs oxygenate it, and then the left side of the heart is pumping that blood out oxygenated throughout the body to basically make our tissues keep our tissues alive, healthy, and keeping our body functioning. And so anything that could insult the heart is going to change the function of our body, and obviously potentially be disabling. And so things that we worry about the heart are the rhythm of the heart, and also if you get heart is a huge consumer of energy. And so when we start looking about ways that we can improve heart health, you got to just think of it at the basic understanding that our heart, 100,000 pumps a day or more, depending on your heart rate. So that heart has so many vessels around it because the heart itself requires so much nutrients and energy just to beat that much throughout the day. So if you have any blockages or decreased blood flow to the heart muscle, you're going to feel it. And so the ways that you can do that is either you have blockages in the arteries, you're not oxygenating it well enough because your lungs or you're smoking and your lungs aren't putting enough oxygen into the blood. All of these things can cause problems for you. And so when you start looking at ways that we can improve the heart, the first thing is going to be is lifestyle. As we always said, that's why I keep pushing why we are so excited about Telewellness MD, is because we offer lifestyle choice. Everything that we do is to surround a healthy lifestyle, and a healthy lifestyle is the best medicine. So you can see the two most preventable health risks, including heart disease, is smoking and obesity. You can tie diabetes right into obesity, and that's why it gets the term diabetes. So these are things that you can change. And so you can quit smoking, you can start to lose weight, you can improve the foods you're eating to reduce your chances of having diabetes. So that's kind of where it starts. And then you get further into lifestyle and you start looking at exercise. Exercise is the number one lifestyle choice that can affect the heart. We talked a little bit about after you age, that after the age of 50, exercise is also the most important for brain health and preventing brain disease. So you can kind of understand exercise is really important across the board as you age, but definitely for heart health. And what happens is when you're trying to make changes for your heart, you have to look at your life, the sleep, diet, and exercise. We talked about sleep, and it's not just quantity of sleep; it's quality of sleep. I get so many clients that I see that you ask them how their sleep is, and they say it's great. But when you really start to dissect exactly how their sleep cycle is, you realize that just because they say it's good doesn't mean it is good. And that has brought to the surface a lot of different technical devices like the Oura ring. That's Oura. It's a great ring. I have that ring. That's something you can wear throughout the day and night. It works just like a Fitbit or an Apple Watch. It tracks your nutrients. It can even tell if your heart's in rhythm. It can check your oxygenation, some of them. But the Oura ring specifically I like because I don't like wearing anything tight at night around my wrist. So it's just a ring that you can wear it, and it kind of goes through your sleep cycles and tells you the quality of your sleep. There are a lot of people out there, and at one point they talked about sleep apnea being a silent killer. And what that means is there are a lot of people that are sleeping and they feel that they get a good night of sleep. Even though they might be tired during the day, they still don't recognize that they have sleep apnea because they're sleeping. And so usually it takes a partner or someone, a family member, to realize that someone has sleep apnea. And a lot of times they can hear the apneic spells while they're actually sleeping. So if someone is actually they're snoring and then all of a sudden they hear a cessation of a breath, that is an apneic spell. And so if you have someone that not only snores, is overweight, but you actually can hear them stop breathing, you need to get them in for a sleep study. I'll even give you a bigger tip is if you do look to go get a sleep study, just make sure that you understand that insurances and life insurance and health insurance can be pretty hard on people with a diagnosis of sleep apnea. So I would say that make sure you have all your health insurance and life insurance set before getting a diagnosis of sleep apnea, or pay cash for your sleep test, because once you have a diagnosis of sleep apnea, we've had a lot of friends and clients that have had a hard time getting life insurance after diagnosis of sleep apnea. So I would say do everything you can to treat the sleep apnea with weight management, snoring devices, exercise. But if you really have it and you have everything in place, then go through your insurance and get a sleep study, because sleep apnea, just imagine if you're having apneic spells and you're not oxygenating your tissues throughout the night, that causes your heart to have to work harder to pump the same amount of oxygen throughout the body. And so what happens is, one is you're oxygen deprived, so that's affecting the brain, that's affecting your tissues, that's going to affect your stamina and endurance and productivity throughout the day. But your heart just has to work harder, and it doesn't get that ability to go through the different stages of sleep to get that recovery and also bring your blood pressure down. And so and then it's also a stress, so it raises your cortisol, and you get in this inflammatory vicious cycle that sleep apnea slowly starts to really increase your risk of having a catastrophic event. So that's one thing. So in just the sleep quality, we talk about alcohol. Alcohol is inflammatory, and just by drinking, especially if it's 2 hours prior to going to bed, you're going to reduce your deep stages of sleep, which then of course is going to it's going to remove that recovery that you need for your heart. So when we're talking about a diet, you can do a lot of different things for your diet, but the first thing is to try to reduce your processed foods and your bad fats. And I can tell you that when you're looking at the whole concept of healthy fats versus bad fats, this argument's been going on for 20, 30 years about, are saturated fats good or bad? Saturated fats are usually the ones from animal products. They're the ones that can be turn hard in room temperature, and then the healthy fats or unsaturated fats are the ones that you're getting mostly from vegetables and seeds and grains. And so saturated fats, they have found, yes, they're not they're not as good as unsaturated fats, but the data always is conflicting, and the most recent studies still show that if you're choosing moderate amounts of saturated fats like coconut oil and animal products, that they haven't put a direct correlation to saturated fats and increased risk of heart disease. Because what it does, it can increase your LDL, your bad cholesterol, your low density lipoproteins, but it doesn't increase the small dense particles that can increase your chances of plaquing. It actually raises the buoyant LDL particles, and so that's why there's some confusion, is that if you're getting your cholesterol tested and you have a high LDL, and you're eating a lot of fish and animal products and coconut oil, and your doctor tells you they want you to put you on a cholesterol lowering medicine, you should ask for a particle analysis first, so they can actually take a look and see what type of particles you have, what type of risk factors you actually have with your cholesterol profile, before putting you on a drug that can have side effects and potentially adverse events on causing advanced aging, just because you need cholesterol for hormone production. So just make sure that you really look at that, and just understand that saturated fats are not bad. You just don't want to consume a lot of saturated fats, but you want to focus on the unsaturated fats, which are going to be things you get from nut butters, nuts, seeds, grains, avocados, and just and make that the majority of your fat intake. So that's pretty important, and I know that that's very confusing, and it's still confusing to people when they talk about their LDL. But what I always say is there's a lot of good products out there that can help with your cholesterol, and that's going to be lifestyle. And so as we start talking a little bit more about getting into the exercise and certain nutrients that you can use, then it'll make a little more sense. So remember the diet. You want to get rid of the processed foods and the trans fats that are in the processed foods. Stick to unsaturated fats. If you have some saturated fats, just use it in moderation. Don't consume too much of the saturated fats, but they're not unhealthy. And if you do have a cholesterol panel and you increase your saturated fats and your LDLs go up a little bit, just make sure you look at a particle analysis before you start turning to pharmaceuticals for lowering your cholesterol. And so then we get to exercise. We have sleep, diet, now we have exercise. And we already said exercise is the number one activity in the lifestyle that can help your heart. And that's just as simple as it can get, with it being a muscle. So what you're trying to do with exercise is you're trying to build that muscle, to make that muscle more efficient. You're trying to drive blood into the vessels that are feeding the heart. It's a workout. And so that's why, when you're looking at exercise, you can't just say you're being active. You can't think that your heart is going to get the workout it needs from just being active, meaning that you're going up and down stairs, you're walking 10,000 steps at work. That's very deceiving. You need to get heart rate variability. You need to get your heart rate up. You need to work on your resistance training, which a certain amount of the time, because that is going to increase the way our body's oxygen requirements are. And so you kind of want a mix of both. So you can still do aerobic exercise. It's very relaxing for people. People like doing it, but you really want to get some resistance training or anaerobic exercise in. So, the American Heart Association says that you need about 150 minutes of aerobic exercise a week, or 75 minutes of resistance training. I like to say it's more closer to 150 to 200 minutes of aerobic exercise. But what I like is, again, high intensity interval training or cycling or boot camps, because that incorporates aerobic and anaerobic exercise at the same time. And so then you can really maximize the time you're working out, but you're getting the benefits of both of those at the same time. And that's going to be somewhere between 60 and 90 minutes. So if you think about that, 90 minutes as a goal, that means 3 times a week, 30 minutes of high intensity interval training, and you could be really doing a lot for your heart. So we talked about sleep, diet, and exercise, and then talking about supplements. So as you're looking at improving your heart and reducing your risk of having heart disease, which we obviously know how important that is, and I can't tell you that there's you just want to do everything you can to minimize your risks of having heart disease, because unfortunately when people start thinking about their heart, you have to think about the rest of the cardiovascular system, which is also your arteries. And so when you have heart disease, if you also could be considering having other vasculature problems too, so you're increasing your chances of having blocks in the arteries of your brain. So when some tips for people to think that they might have heart disease, one thing to think about is one is called, if you look at your lower extremities and you notice that your feet are getting cold, you're losing hair on your lower extremities, that could mean that you have occlusions of some of the arteries in your legs. Same thing with men that start getting erectile dysfunction at a young age. These are all signs that you're having blood flow issues. And so if you're having blood flow issues in other areas of the body, there's a good chance you could have one in your heart. So don't wait till you're sick. If you start getting into your 40s and 50s, if you have a very strong family history of heart disease, you have to start looking at those little things to think if you may have some blockages in your heart that you could get looked at before you have some sort of a cardiovascular event. And so just remember also is that if you have blockages in your heart and you haven't had a heart attack, getting stents and getting your heart evaluated, and even if they had to do a bypass, you're still preventing a catastrophic heart attack, or even a mild heart attack that could be disabling, which would reduce the ability of the heart to actually pump blood throughout your body. So I tell a lot of times when people hit 50, if you have risk factors or if you're exercising aggressively, there are things that you can do even though that your insurance won't cover it. One of the things that a friend of mine that's a cardiologist said was that you can pay out-of-pocket cash because your insurance is not necessarily going to pay for it, but you can get what's called a CT angiogram, which you do a CT with and without contrast that can really see one is your calcium score to see if you have a high risk of calcifications, and the second thing it can do is actually get a look and see if you have any blockages in any of your vessels that might make them want to do further evaluations. But all this is to prevent having a heart attack. And so if you get stents put in to open up those vessels of the heart, you're back to regular activity after that, but you didn't suffer a heart attack that kills heart muscle. So don't be shy at being aggressive of getting heart evaluations, even if you have to invest in it and pay cash for some of these things. A CT angiogram is less than $1,000. Usually ranges around $750, and is probably the best test you can do, better than a stress test, better than a nuclear stress test, to see what your overall heart function is at that moment. And so that's one consideration if you're at an age where you really want to make sure, especially if you're going to make lifestyle changes and you want to start working out more aggressively, you just want to make sure your heart is healthy. So definitely check with your doctor, check with a cardiologist before you get into some sort of aggressive exercise routine, even though it's that important. So when we start looking at supplements and things that you can do, there's a lot of options that we have on our platform. But there's a doctor named Dr. Sinatra that looked at the metabolism of the heart and how important the heart is as far as how it utilizes energy. And he had three nutrients that he thought were really important, and it was kind of called as the Sinatra protocol, and that was CoQ10, L-carnitine, and ribose. And it's kind of nice because those all are energy molecules, and so that's why you hear people talking about CoQ10 for the heart. But it is a really important supplement. Again, especially after you start getting over the age of 40, supplementing with CoQ10 ongoing is really important. But then you have L-carnitine and ribose, and so I like ribose. Ribose is one of those ones that I usually use for most people that are having energy problems, like physical energy problems. So it makes sense that ribose would also be a good one for your heart. And so that's usually 5 grams of ribose. You get it in a powder, put it in one of your bottles of water every day. And L-carnitine is 150 to 300 milligrams twice daily. And CoQ10, you can get up to 1 gram a day of CoQ10, 1,000 milligrams. Another important nutrient that no one really talks about is fiber. Fiber actually, some doctors actually think fiber is the most important nutrient for us to take for our heart, and that's mostly going to be soluble fiber. And most people should be getting somewhere between 15 and 25 grams of fiber in their diet every day, and I can tell you that is hardly even coming close to being met. But most importantly is soluble fiber, because of how it can affect our cholesterol and reduce inflammation in our body. And so soluble fiber is really really, really important because it kind of pulls out the bad cholesterol and just and we get and excretes it. So you can still get soluble fiber is going to be the one in certain fruits and vegetables. That's the one that kind of pulls in water. It's soluble, and then you have the insoluble fiber that's really going to be helpful for bowel regularity, which is also extremely important because bowel regularity is going to be what helps with our micronutrient absorption. So both of them are important, and both of them we do not get enough of in our daily diet. So I like to tell people to get a good fiber supplement. Again, you can put that in a water bottle and really increase just having bowel regularity enough is really important. And I know there are a lot of people that would love to have better bowel regulation. Some other good nutrients that there's one back in the day. If you're my age, you're probably going to remember when there was a big push on everyone getting homocysteine levels checked. And homocysteine was a lab test that everyone checked because they found that people with higher levels of homocysteine had a higher incidence of heart disease. They stopped doing a lot of homocysteine testing because what they found out was that the real treatment for it was using folate, and so it started out using folic acid. Then they started moving into using methylated folate because certain percentages of the population have a genetic defect called the MTHFR, which causes a inability for us to methylate and take the usable forms of folate and B12 and turn it into the usable form by methylation. And so just taking a methylated form of folate is also a way to reduce your chances of having elevated homocysteine. So again, if you've ever had a high homocysteine level and doctors were concerned about it, just make sure you're getting methylated folate. Start at a low dose and then titrate up, because some people can feel a little bit ill if they go too high on the methylated folate. So some of the other nutrients that are important: amino acids, proline, lysine, arginine, glutamine, and so if you get on a good amino acid blend, you're going to find that there's a lot of different reasons why these amino acids are helpful for the heart. Arginine is a vasodilator, proline and valine. I think it's a proline and lysine. Yeah, that's the one that's in another physician's kind of to-do list as far as heart health goes. And so just getting on a good amino acid blend. We at TeleWellness, we have a few different nutrient injections that have amino acid blends, and I really like that, again, because of course we're taking away the chances of having the first pass effect from certain supplements and just getting it 100% bioavailability. So just remember the methylfolate, the fiber, you got CoQ10, you have L-carnitine, you got ribose. Magnesium is another good one, taking magnesium in the evening. That also helps with bowel regularity. They still use magnesium on cardiac floors for heart conditions, and usually between 400 and 600 milligrams of magnesium. If you want it for bowel regularity, magnesium glycinate or citrate. If you're looking for still getting your magnesium in, but you want a little bit more for the brain, that's magnesium treonate. And then what else do we talk about? Omega-3 fatty acids. So omega-3 fatty acids is something that we can't produce. That's another one. 1,000 to 3,000 milligrams a day has been shown to also help with reducing inflammation and improving our arterial walls. And so that's one that we're usually the recommended daily allowance is usually less than we need, and so definitely going to need to be up somewhere if you have higher risk factors around 3,000 milligrams a day. So then we'll also, the last one I'm going to say is vitamin D3, which with K2, because remember when we talked about vitamin D3, that one of the last Q&As we talked about how K2 helps to channel calcium into the spots it's supposed to be so that it's not going into plaquing. Vitamin C is another good one. When they did the studies on vitamin C was not as much found to be helpful for preventing infections, but it was more because they found of what it does in arterial walls. And when you looked at what was happening when people had vitamin C deficiency, another thing that we can't produce, people were getting scurvy, and so really what they found is that when you have vitamin C deficiencies, it affects the way arterial walls are by causing cracks and fissures in it, which increases the chances of infections, which is also a big theory on what causes heart disease more than cholesterol, but also those big buoyant cholesterol particles can also get into these scabs or these lesions and start causing plaquing. So again, a lot of information, but you can kind of see where this all goes back to. This all goes back to lifestyle and making the choice to be healthy. And so if you're under the age of 50, this is your chance, especially if you're getting into your 40s. This is where you really start having to pay attention to your heart. So, you know, lifestyle is going to be your key. That is your key for living a healthy, happy life. You do not want to wait till you have some sort of a, you know, whether you're just diagnosed with a disease or you have something more catastrophic happen. That is the key to lifestyle and balancing and moderation, is because you are trying to prevent disease. And remember, everything that we do to live better, age healthier, is also the best disease prevention. So you're getting a bonus. So just don't think that we're doing age management just to look good. It's both internal and external. And so the better you look, better you feel, you're actually preventing disease. So all these things that we're doing for your heart, you can see roll over or crossover into every other area of medicine that we're going to talk about. It's just that important. So if you guys can get your sleep, diet, and exercise in line, and you just keep it going and don't stop, you're eventually going to improve or reduce your risk, improve your heart health, but reduce your risk of having heart disease. So lastly, you know, I will mention, you know, intermittent fasting again, just because if you look at the way intermittent fasting works, it really works by, you know, when you make the certain dietary changes. I'm not going to get deep into intermittent fasting because that's a whole conversation, you know, I love to talk about. But just basically think about it is that, you know, when you're doing intermittent fasting, your body is choosing fat to use as a fuel source. And so there is a science behind it. I'm not going to just tell you, you just have to just go completely ketosis, you know, and forget carbohydrates, because there's science behind it. But look into intermittent fasting, because that is an exact way that you can start burning fat, reducing body fat, reducing body weight, improving your endurance, and improving your sleep, reducing weight, which can improve sleep apnea. Obviously, all these things are going to work on every component of lifestyle. So that's a good little, you know, talk as far as the, you know, the importance of the heart and what we're trying to do to just minimize your risk of getting heart disease. So, you know, take a look at our site, telewellnessmd.com. See that we have a lot of different amino acid blends. We have some injections with vitamin C, all the B vitamins. We have the Carb Rev, which, again, if you guys want a life hack, you know, 3 months of Carb Rev is super important. You know, in 90 days, you guys could really have yourself making that metabolic switch and fat adaptation to really start burning fat as a fuel source. You know, again, growth hormone is another one. Anything that has helps our body promote more growth hormone production, and then our liver producing insulin-like growth factor. If you read about insulin-like growth factor and heart health, if you type that in Google, watch what comes up first, and you're going to see that there is tons of studies on how growth hormone and insulin-like growth factor can help with cardiac remodeling or heart remodeling. I've had multiple clients that have either had heart attacks, congestive heart failure, were told that their ejection fraction was so low that there's nothing they could do about it. And just with insulin-like growth factor or growth hormone and increasing insulin-like growth factor, we've taken people's ejection fractions from 25 to 30% back up to 60%, something that the cardiologist didn't think would actually happen. But there is a lot of data on it. So again, this is why we do what we do. This is why telewellness is there, is that there's a lot of information that you can find out that you're not going to get in a traditional healthcare visit. So sometimes you gotta dig on your own and find these solutions and put them to work. But remember, these are only as good as your lifestyle is. So make your lifestyle the priority, and then surround these products around it. But once you have a good lifestyle in, it gets a heck of a lot cheaper and a lot less of an investment. So good. So I guess we'll see you next week. Again, this is Q&A with Dr. A. I hope I didn't talk too fast, but that's what I do.